This is Black and White Radio. There's the Equals featuring Eddie Grant on the lead vocals with Baby Come Back. We're in Javier 94.9 FM and around the world, www.blackandwhiteradio.com. It's our health appointment with Harley Street osteopath and all-round health advisor, Jeremy Kenton. We are talking headaches, and now we're moving on to migraines. Now, they're very different, aren't they, to headaches? People who get them know how different they are.
They are. If you've got a headache which just starts instantly, that's a headache. But then we have two other types. We have migraine and we have cluster headaches. Mm-hmm. Now, migraine and cluster headaches are very similar, but very different.
Right.
Now, let's imagine you wake up and you've got slight visual problems and your eyesight suddenly starts to narrow down. You may become very sensitive to light, so you look at a light source and it hurts as you look at it.
Right.
You feel a bit sick, you feel nauseous, you get a headache, usually on one side. You may even get tingling or pins and needles in your face. You may feel generally numb in your head, and the severity of that is such that you've got to go and hide. That's migraine.
Right.
Very severe. You may even vomit with them. And if there are any migraine sufferers out there, they will know it is horrible. Absolutely horrible.
Now, that's very, very distinct. Now, you sometimes don't get all the symptoms. So sometimes you don't get the pain. You get the flickery eye thing.
Always get the what's called aura. You'll know that it's going to happen.
Yeah.
It's
not
that
sense of
everyone gets
impending
vomiting.
doom.
That's it.
It's awful.
Do you suffer?
Well, I've had one or two which I put down to migraines. I wouldn't like to say put my hand on my heart, but I didn't get I managed to get home and lie still in a darkened room before the real pounding pain arrived. But the eye flicker thing, and that sense of this is getting worse, it's the sense of impending doom is the worst bit. It seems to be getting worse and worse and worse. I've had one or two.
So you're a sufferer in the sense.
Yeah, but I don't get them anymore.
Right, so you've gone past them. Now, that all boils down to cause. Now, if ever you could have what's known as a multifactorial condition, it's migraine.
Right.
Let's look at the potential causes. It could be circulation.
Right.
So you can have an inherent narrowing of the blood vessels inside the head that lead to a pattern of migraines,
right,
where there's very little that you can do about it. Or it could be your eyes. Simpler thing is not having had your eyes checked. Or it could be a bit of stress on top of those other two. Or it could be coming from your neck. Or it could be coming from various other neurological factors. Or, and this is the serious part, you may think it's migraine, but it's actually coming from something inside the skull that's applying pressure to either nerves or blood vessels, which obviously needs investigation.
Well, so I'm still alive, and this was some time ago, so I hope I didn't miss out on that.
We can forget you on
yes,
that
I think I'm slightly reassured.
But if you can imagine, and once again, I don't want the listeners to panic, that if you've got something inside the skull, what's known wonderfully in medicine as a space-occupying lesion. So if you can imagine something that's getting bigger and bigger and bigger, and as it's getting bigger, it's putting pressure on nerves and blood vessels and producing that very severe headache pattern, which needs to be looked at, which needs to be scanned, and which needs, if necessary, to be removed. It does not mean that you've got a death sentence by any means. But it can be a very serious cause, so people think they've got migraine or they think they've got normal headaches, but it's something more sinister going on.
You see, I'm feeling a bit guilty now, because when I probably should have got them checked, because I made some assumptions about what caused it. And they may have been wrong. I might have had a space occupying, basically.
No, you wouldn't be here now doing
this
radio
no, I know.
If you'd left it that long.
I know, thankfully, that it wasn't. But it could have been. I didn't get it checked.
But in your case, it wasn't.
No.
Right.
No, so that's okay.
So that's all right.
Yeah.
But it is important that if you do get these, that it's established that it is a straightforward migraine and nothing more sinister.
Right.
So you must go and see your GP, who'll send you off to a neurosurgeon or a neurologist, who'll do probably a CT scan of the brain to make sure that there's nothing nasty going on.
Right.
On the simple level, a very common cause of migraine is actually coming from the jaw. Now, we have, at the point where the lower jaw meets the skull, something called the temporomandibular joint.
Right.
or TMJ.
Right.
Now, simpler thing as your bite not being correct. And you know when you go and see the dentist and they stick this little bit of waxy paper that looks like a
Yeah, it's
sort of a little bit of
carbon
waxy paper, horrible
Yeah.
stuff, and they put it in, they grind from side
Yeah.
to side, which is always difficult for people,
Yeah.
and then they sort of fiddle around with you, and they may build up a tooth on one side because your bite is incorrect. Now, if that's unbalanced, that can produce classic migraine symptoms, and it's amazing how many people are going round where their bite is slightly lopsided, and that produces their headache pattern.
I suppose that can happen from decay on a tooth or previous dentistry that hasn't gone well and things like that.
That's right. Or because you've also got to look at those conditions where you were just born like that and where the shape of your jaw is slightly disturbed. So it can be those kind of things as well. Or it could be that along with a mixture of stress, so that you're grinding your teeth at night and that produces problems, and that will trigger off a migraine pattern.
I'll tell you what I think mine was, and this might chime with a few listeners as well. At the time I was working in a terrible office environment. Absolutely terrible. And we spoke about this a few weeks ago, about how bad sometimes working environments are. I had a terrible chair. I was probably hunched up, extremely stressed. And get this, I've got a fluorescent light above me, which is flickering. I've got two of the old type computer screens. Now they flicker at about 50, well, exactly 50 hertz. And they're old and they're not very good, and they're next to each other, and they're probably flickering at different rates. So I've got two flickering computer screens in front of me, a flickering fluorescent light above.
Reflecting on the screens.
Reflecting on the screens, all interfering with each other. No outside daylight whatsoever, because it was in winter. And it was in Great Britain. Okay.
Where it's always wintry.
Exactly. No sensible oxygen or air in the building whatsoever. And focusing intently on these computer screens. Now, in those circumstances, I was not terribly surprised when I used to leave work and not feel terribly well. And on a couple of occasions, I only just got home in time to lie down in the darkened room. I could feel the eye flickering coming in of the sort of classic ongoing migraine.
That's right, because your eye is then beginning to try and match the flicker rate of the screen, which is then sending the wrong electrical impulse to the brain, because the brain's saying, where the hell am I? You know, what's going on here? Why is everything moving at 50 hertz?
Yeah.
And so therefore it tries to orientate you. It's almost like seasickness in a way, that kind of feeling. So it's not surprising. But it's amazing how many people do get that office-orientated type of headache. Even with modern flat-screen monitors, they haven't got the flicker rate, but often they're set in the wrong position. Now, I'm going to nag at you here.
Right.
Your chair is appalling. Your screen is too far away from you, so you're having to lean into it, and it's at the wrong height.
Right, okay.
And the other one is at totally the wrong angle, but it's at least it's at the right height.
It is at the right height. However, I will put my hand up in justification. I try not to look at them. You may have noticed when I'm doing other when I'm speaking with you, I'm speaking with you. When I'm reading something, fair enough. But a lot of the time, I'm staring into the middle distance.
Right, but if you were having to do it where your whole job depends upon you looking at a computer screen and it's set wrongly, so your neck is slumped, it's affecting your eyes. The lighting, as we said before, is in the wrong position, wrong type of lighting. Use of natural light's all important. Fill your room with mirrors to reflect the natural light. All those things will contribute to the very low-grade type headaches that people can get. And if you're a migraine sufferer, it will trigger a migraine attack.
And I must say, I would ask you this: when I used to lie down flat. I used to drink half a pint of water, lie down flat in a darkened room, and it would suddenly just go. Yes. It would suddenly. It's such a relief, because it sort of disappears almost immediately, and maybe you get sort of a minute and a half sleep or something. But it would. 1 minute you'd be feeling terrible, and the next minute it had gone, completely gone, and you sort of wake up and think, "Oh, that's gone. Oh, that's better." Is that typical of a migraine as well? That it?
No, you are very lucky. A true migraine attack can last from anything from half an hour up to the whole day.
Right.
Another trigger for migraine, of course, is the dietary side of things. And there are certain foods which are known as vasoconstrictors. In other words, they cause the blood vessels to constrict, to become narrower. And the classic ones are, and like everything in life, they're always the things that everybody loves.
Dark chocolate.
Cheese, chocolate,
Yep.
usually milk chocolate, high in sugar,
right. Yep.
oranges, Marmite.
All my
Well,
favourite
you either
things.
love or hate that one, don't you? Cliche.
They're all my favourite things.
Exactly. But life's like that, isn't
Yes, it is. So you should be, if you get migraines, you should be a bit careful of those
You
foods.
should avoid oranges, you should avoid chocolate, avoid coffee, anything that can potentially narrow the blood vessel.
Right. We shall find out more about headaches, migraines and painkillers. It's our health appointment with Jeremy Kenton here on Black and White Radio. Lots on the way today. It is a Friday, of course, so E.T. Eric Taylor will be here from 3 o'clock this afternoon with that Friday feeling.